Well, the pandemic caused so many surgery backlogs. The Ford government is now injecting more than $300 million into our hospitals to try and get things back on track, but the limitations set for the sake of public health. Well, they also encourage medical teams in this country to think outside of the box and even outside of the OR.
Life-saving surgeries had to continue, and that led to the world's first heart valve replacement surgery using extended reality to take place right here in Toronto. So to understand how it came to be, we welcome to CP24 tonight Senior Clinical Specialist Caroline Marino with Medtronic. That's the company behind the technology. We appreciate you making time for us, Caroline. This surgery was completed in January. There have been a dozen cases since then. How does this work?
Well, first of all, the lens that we're using is the HoloLens from Microsoft. So it's a pair of mixed reality glasses that simulate holograms into the user's field of vision. And that also allow anyone from a distance to connect to the HoloLens, so giving this person access to the OR and where the surgery is taking place. So it really gives access to anyone who can't join the procedure because of COVID or because of the distance. So clearly giving access to, a lot of patient best expertise. It was great.
Yeah, we're watching some of the video here from a story earlier this year. It's quite remarkable. I understand it's called extended reality or XR technology. How long has this been in the works and being developed?
So we had to kind of rush developing the system itself and the guiding behind the HoloLens because of the pandemic to be able to provide care to patients. So working closely with an engineer firm from Trois-Rivières in Quebec that made this all possible to use in the OR field.
So the person who's using these glasses, are they consulting or are they somehow involved in the operation? Are they participating?
Yeah, clearly. So they're giving guidance to the physician who's actually doing the surgery. It's still a newer technology, and some physician has less experience if it's complicated cases, complicated surgery. So the physician seeing what's going on in the operating room can give all his expertise and help to the physician who's doing the actual surgery.
So is there also then a training element to this as well beyond actually undergoing surgeries? It would seem that you could be almost anywhere and helping other people learn how to perform the surgeries next time or in the next several months.
Yeah, exactly. Well, the HoloLens is allowing us to kind of incorporate holograms. So as a company, Medtronic, we kind of incorporated all the step-by-step procedure. So when the surgeon is wearing the lens and doing the procedure, he sees all the guidance from the best practices that Medtronic is teaching to do the procedure.
What were some of the hurdles that you had to get through to get to this point?
Well, we're working with internet. So internet in hospitals are, it's not the best. So we had to make sure there was no lag for the person, that is assisting from the distance. Because this is, it's milliseconds that can be fatal for the patient if we don't see in real time what's going on. So it was a big challenge to be able to video stream all the live information that's happening during the surgery. So X-ray, echocardiogram, vital signs, those are all the things that we had to make sure the physician from the distance could see in real time.
So we've been talking about the fact that, Ontario is dealing with this backlog based on the waves of the pandemic. They're going to try to operate their operating rooms at about 115%. So is this kind of technology going to be able to help work on this backlog? Is this something that could be employed pretty quickly now?
Well, now that we've developed this way of video streaming stuff with no lag, clearly this technology, can be used for any type of medical device, any type of surgery, intervention, even just for rounds, not having a physician physically in the hospital, can clearly help see more patients in the same time.
And where do you see this technology going in the future? Could it connect doctors around the world?
Clearly, yeah.
Wow. What are your goals with it? What does Medtronic want to do?
Well, clearly we want to expand it to like other division of our company. So right now we had a big need to help with the TAVI, so the trans aortic valve replacement, because that was like critical surgery, but it can be implemented in any other types like spine surgery, endovascular surgery, any types of even just like teaching point with the new surgeon, new fellows, even with nurses. So it's clearly a new technology that can increase the patient access to treatment.
Are there certain surgeries that this does not lend itself to? You just listed off several that it sounds like it could be useful for, but are there certain things that are just like there's no way the doctor, the team, they all need to be in that OR?
Well, I'm tend to say no, because the HoloLens is so clear. You really feel like you're in the room, and it even gives you a better view of what's going on, because it's a 4K image, and you're so close to what's going on. So, and there's no lag. So clearly, I don't see how it wouldn't work in any type of surgery.
Are there any ethical considerations for the fact that the surgeon is not technically in the OR? Anything that could be problematic there?
But there's always one surgeon in the room doing the surgery, and he just being assisted by an expert in that field somewhere in the world. So clearly, ethically, there's a surgeon always in the room.
Well, and this is the first in Canada for the entire world. So I'm thinking about that one patient who underwent that heart valve replacement in January. Were they notified? What was the conversation like?
Yeah, there was like an agreement of sharing information as it was, through internet or stuff like that. But we made sure it was encrypted at the source and decrypted at the receiving end. So, yeah, we made sure, everything was legal from that perspective.
And what was the feedback from the surgeons?
Those surgeons, they like new technology, they've been trained to learn new technology. So they, really liked working with the HoloLens and being able to see those like holograms in their OR environment. They really thought it was fantastic.
Caroline, I realize with fairness that you're going to be biased because this is, part of the company that you work for. But, we talked about earlier this week, this was the 100th anniversary of the discovery of insulin, not far from where we are. Where do you think this ranks in terms of Canadian medical achievements?
Oh, that's a tough question. I would say what we accomplished in a short amount of time to be able to give access to patient care probably was a big achievement for Canada and even for the medical industry in this world.
Well, we appreciate you taking time for CP24 tonight to explain it all to us. Thank you so much, and all the best in the future.
Thank you.
You're welcome.